Today's topic is lectins. Lectins or hemagglutinin, these are anti-nutrients and they have received much attention due to popular media and fad diet books recently because they have been considered as major cause of obesity, chronic inflammation and autoimmune diseases. These are found in all plants, but certain raw legumes, beans, lentils, peas, soya bean, peanuts and whole grains, they have highest amount of lectins. These are defined as proteins which bind to carbohydrates, and same features of these lectins were used to different plants in nature, but whenever human consume it, it can cause problem to human digestion. They resist being broken down in the gut and are stable in acidic environments too. The most publicized account reports severe reactions in people eating even small amount of raw or undercooked kidney beans. They contain 5-hemagglutinin, a type of lectin that can cause red blood cells to clump together. It can also produce nausea, vomiting, stomach upset, and diarrhea. Milder side effects include bloating and gas. Legumes and cereals, they contain these minerals, so the concurrent presence of lectins along with other minerals can prevent the absorption and the use of these minerals in the body as well. Lectin can also bind to the cells lining the digestive tract, and this can disrupt the breakdown and absorption of certain nutrients in the body and alter the action of intestinal flora. They can potentially cause an autoimmune response and are theorized to play a role in inflammatory conditions like rheumatoid arthritis and type 1 diabetes. Harmful nature of lectins. They impair the nutrient absorption, as has been proved by a number of animal studies. That if high doses of isolated lectins or raw legumes are given to the animals, this can lead to reduction in absorption of certain nutrients. Besides this, they also increase the intestinal permeability. They can alter the gut bacteria because animal studies have using purified kidney beans resulted in bacterial overgrowth, and raw kidney beans, they contain 5-hemagglutinins, a toxic lectin, and this can result in severe abdominal pain, vomiting and diarrhea. They are also responsible for immune system stimulation. There are some theories which suggest that lectins may trigger autoimmune disease or inflammatory diseases. There are several ways by which we can reduce lectins in the food. Cooking, especially with high heat methods involving boiling or stewing or soaking in water for several hours, can inactivate most of the lectins. Lectins are water soluble and are typically found on the outer surface of food. So, if food is exposed to water, it can be removed. Raw beans simmered at low heat, such as in slow cooker or undercooking the beans, will not remove all the lectins. The body can produce enzymes during digestion which can degrade some lectins. Other processes which deactivate the compounds are sprouting the grain, beans, etc. It is possible that one has an underlying digestive sensitivity, for example, irritable bowel syndrome, and they are more likely to experience negative symptoms from eating lectins and other antinutrients. Because the reported symptoms of lectin sensitivity are recognizable with physical discomfort, a reasonable solution is to eat less or less often the foods that cause digestive. However, there are certain benefits of lectin containing foods also. Lectin act as antioxidant which protects cells from damage which are caused by the free radicals. They also slow down the digestion and absorption of carbohydrates. Early research is also looking at use of non-toxic low amount of certain lectins to help stimulate gut cells growth in patients who are unable to eat for long periods. They also have application in anti-cancer treatment. These are certain sources of lectins containing foods like legumes, whole grains, nuts. These are associated with low rates of cardiovascular diseases, weight loss, and type 2 diabetes. These foods are a source of B vitamin, protein, fiber, mineral, and healthy fats. There are several pros and cons associated with lectins. Lectins can cause adverse effect on health. Lectins also play many vital roles in the body. They regulate cell adhesion and are involved in immune function and synthesis of glycoproteins. They are involved in immune regulation. Some researchers have indicated that they might have antimicrobial properties as well, and they are effective against certain types of bacteria. They are difficult to digest, and consuming larger amounts can damage gut wall and can also result in lead to leaky gut syndrome. This is a condition which is characterized by increased permeability in the gut. This results in the leakage of substances from intestine into the bloodstream. Lectin can also act as antinutrient, meaning that they can interfere with digestion and absorption of foods, and this results in risk of nutritional deficiency. Thank you.